I grew up in a medical family. My mother is a nurse, my father was an OBGYN, and I'm the oldest of four. I expected I was probably going to continue on the family lineage in some way, shape, or form. And I started working with my parents in Dad's office when I was 15. And I learned how to drive, driving him to deliveries. So I'm not the best driver. And yeah, it just always seemed natural. In about the third or fourth year of my surgical practice, I was practicing at a hospital that was going to become, and actually did become, the very first bariatric program in the state of Indiana. And I was the principal general surgeon. I had done some form of bariatric surgery in my surgical residency, but at the time, in the early 90s, nothing was being done in Indiana. And so when I was approached, initially I thought, geez, nothing's happening there. What do you mean you want me to do that? So I was flown to Davenport, Iowa, and looked at another program with surgeons who had been doing this for quite a long time, and went with the medical director of the nationwide program at the time. And I was very, very impressed at the fact that it was a real multidisciplinary, comprehensive. It wasn't just, hey, somebody wants to go do some surgery. And the results were good, the safety record was good. And so I started to really get interested in embracing that concept. So I think it was serendipity, maybe, and it was a good match. And I'm very fortunate to have been now doing that for about 17 or 18 years. Away from the office, I am a mother of three, and I am a gardener. I try to figure out how to garden in gloves so that I can come in the next day, but it's a passion. I love animals, and I learn languages. So the Rosetta Stone people must love me because I've got 7 or 8 of their, different languages. And now I've gone on to a different brand of learning languages because it's just fun. What I enjoy is the human relationship, and I'm a little bit wistful about it because I see the beauty of the technology helping us to make diagnoses and treat things, but to me the essence of medicine is one human being helping and caring about another human being. And sometimes I really don't feel like sometimes in a cancer situation, I may not be able to cure someone, to help to the fullest extent, but you can always help just by being another person there, just a caring, a touch, a hug, and it's more meaningful to patients than you would think. So I develop some really nice friendships, and I think it's important for me that my patients feel comfortable with me and hopefully have a trust, because that's what I expect when I go to a physician. If I don't get a good feel, I'm not going to have a good relationship with them. And I still think that even if it's hard to find, you ought to try to do that, because you deserve that. I think it's real important. The word bariatric has to do with iatros is the Greek word for physician or surgeon, and Bari is volume. What we're doing is changing or modifying the volume of the stomach, and that's a very simplified look at what bariatric surgery does. The surgery itself is one component of a really comprehensive program, and the program is the thing that makes success happen. The surgery is a tool to help someone be able to be effective with their diet, and until most people get some weight off, exercise is kind of hard. The more weight you take off, the less your joints hurt, the better you feel about yourself, the more you're going to do. So it's kind of a springboard. And the fourth and the most essential part of the whole thing is that you're going to change what you did up until, the time that you entered the program. Because the goal is not just to have the surgery, the goal is to be successful and stay successful. So figure out, not how to be perfect, because nobody's ever going to be perfect, but how, for the most part, to live through the day, get through the day, and, keep yourself healthy. Have some not so good days and figure out the next day. Don't beat yourself up. Get up and kind of go at it again. How to figure out how to be at a restaurant and not be so bad. Family gatherings, work, all those places where typically you feel like, boy, if I'm on a diet, the only place that I can do this is kind of by myself. So the behavioral part gives people the tools to be able to function, day to day. And the people who attend what we call the support groups afterwards to kind of have those tools are the people that long-term are the most successful. Can people do it by themselves? A small fraction of people. The surgery is not what does it. The surgery facilitates the person who is doing it to use the diet and the exercise and the change to become successful. So, when people say, oh, the surgery works or the surgery doesn't work, the surgery works to the extent that it's going to work. But what really makes the person successful is the program and their involvement in the program, kind of like a family, So the surgery itself can be broken down into a couple different types, but there are basically a couple ways to help you to eat less, fill up quicker, and hopefully not eat the wrong kind of food. And then it gets more technical after that. On initial consultation with me, it actually is information throughout the whole program. So the dietitian, the information in general about how the insurance process works, and the information I talk about is not so much the nitty-gritty about this surgery and the technicalities, but just conceptually, why anybody would even think about doing something like this. What some of the evolution of the weight problem in our country is, why it's not an individual, character failure or something like that, and how trying to make yourself better, trying to lose weight and become healthy really can be the best thing that someone does. Not so much by, saying, hey, you're going to lose 100 pounds or 200 pounds, but really, to me, the most exciting part is talking about people enjoying things that they thought they would never be able to do. And really being able to live life to its fullest, because people who have never dieted before, don't have a concept of what things you might give up, and patients tend to minimize, oh, well, that's okay, I don't need, I did that before, but they are essential things. It sounds crazy, but crossing your legs, being able to move around comfortably, buy something off the sale rack, and not be mortified just to go out and shop. Summertime's a big time. People get so excited that they can actually go to an amusement park or something like that and actually participate instead of stay in the background. The thing I love the best is when someone tells me that they're so proud to drop their child off at school because they were embarrassed before. My son can put his arms around me. Oh my gosh, what other surgeon can say, this is such a cool thing? You know, and I tell people, you've only got one life. Don't minimize the minutes, you know? And so for me, it's a privilege to be able to be part of a process where it helps people to get that quality back, to feel young again and to do those young things. It's the best.